Well, should we be concerned as we see an increase in a number of children being hospitalized because of COVID-19? South African Medical Association Chairperson, Dr. Angelique Coetzee and Dr. Michelle Groom, they are joining us. She's the head of the Public Health Response and Surveillance at the National Institute for Communicable Diseases, here to talk to us a little bit more. Good evening, ladies, and thank you very much for your time and joining us tonight here on In Focus. The South African Government Medical Advisor, Vasila Jasat, saying there is an alarming increase in hospitalization of children, particularly under the age of 5. Dr. Coetzee, does the Omicron variant pose a higher risk to younger children, especially that cohort, that age group of 5 and below?
Good evening, and going to speak out of my clinical experience and that of my colleagues. Currently, we don't see a higher number of patients being infected or children being infected with COVID-19 regarding the Omicron variant. So we do see them at the surgery. Yes, they're there. And we see mild cases. So however, there might be a different picture at the hospital level. But as far as as per my understanding, is that a lot of these children are being admitted for something else, and then when they are tested, they would then test positive for COVID-19. But we call it incidental. It's not because of the COVID-19 variant that they are being admitted, but because of compulsory screening. And I think that would be the same on all of the age groups. Yeah. Also remember that in the beginning of any pandemic, your children would be the first to spread the virus, get the infections, and spread it, going to, home back, take it back home to the elderly, to their parents, to whomever is living with them. Also need to understand that children's immune system are much better than an 80-year-old person whose immunity are not at the same level. Yeah. So from a primary healthcare level, we haven't seen these severe children. Maybe they go straight to hospital, but they definitely don't pass through us.
Yeah, certainly, Dr. Michelle. I mean, the department itself worried about that spike in the graph. Does what Dr. Angelique explained there as incidental your experience as well? And or what is the explanation as to why this cohort of patients are seeing an increase?
Yeah, so I think this wave has been a little bit different, and we were seeing even towards the end of the third wave that there were more children being infected. And I think partly of that was just, with the first two waves, children, there was the initial lockdown, schools were closed. During the second wave last year, it was during December, so the children, weren't at school. So I think we've seen this increase in cases that started particularly amongst the young adults. So it was these, the tertiary educations in China, and we've seen kind of a lot of the initial infections in the younger age groups, and those are often the parents. If we look at the 25 to 39-year-old age group, those are often the age group that has young children and potentially may spread that to their children. This group is not the vaccine coverage is much less in that age group. So I think it's a little bit early. I think things are maybe just be a bit skewed kind of in the beginning, and I think we've already seen this week that proportion of admissions in the under 5s is decreasing even compared to last week. Yeah. So I think a lot of it was just the concern with the rapidly increasing cases. Most of the cases that are admitted have been mild. They on average stay around 3 days. It may be that clinicians are just being precautious in terms of admitting. And as Dr. Coetzee said, we've been seeing how, influenza rates have also been going up. There's lots of other, diarrhea and respiratory pathogens at this, we've had a long period where we haven't seen these diseases. And now that we've opened up the restrictions, I think we are seeing those. And so in young children, they usually present with very non-specific symptoms. They will come in with vomiting and diarrhea. They may have shortness of breath, fever, and it's very difficult to always know exactly what's causing it. They will be tested for COVID because it's required. And then you may have this, it's very difficult to say, is it now the COVID that's causing it? It could well be, something else. So I think it's at this stage, although we did see that initial kind of spike, almost, I think there are some reasons not to be too alarmed at this stage, and we need to really just look how the trends seem to be now, decreasing again in that age group.
Dr. Coetzee, initially when I spoke to you, this was in the onset of the COVID-19 pandemic, we were saying, no, kids are not going to be affected by this. At the time, its evidence seemed to have been pointing to that. Is there evidence now, maybe, to support the view that the virus could have evolved to target the younger age groups?
It's difficult because, again, in the beginning of any wave, it's always the younger age group that would start spreading the viral and get most of these infections. You very seldom will start a new wave with the elderly getting sick. They came later into the picture. So normally it's the young children. And yes, I've seen 4-month-old babies. I think I have seen 2 of them. They're really not sick. The concerns is if they get a secondary infection. We know that COVID is a respiratory infection. And we also know that babies under the age of 9 months, it's got difficulty in coughing and all of that. So, yes, we might see more sick children, but then it would be related to not only the virus, but the anatomy, if I can put it like that, of a young baby, the inability to have proper cough, be able to cough properly. And so it's not to say that they are now more sick. Their severity is worse than that of adults or the younger generation. So altogether, what we currently still seeing, it's now the 3rd week that we as clinicians are seeing these patients. Yeah. And we still see mild diseases. It becomes extremely difficult if everyone wants to say, yes, there's severe cases and there's cases going up in the hospital, and then you say, that's not what's happening. Yeah. Because remember, it's not only me. We also look at and speak with our other colleagues. Yes. I'm part of a group, PPO Serve in Pretoria. We track hospitalization from GP groupings on a daily basis of the GPs there. And so far, since the pandemic started, 2 patients had been admitted and both already been discharged. So it's difficult. We don't see this.
When we speak to virologists, they say there are 3 things that they look at. One, you've already articulated, severity of disease, but the other 2 is the difference in protection and immune evasion. But now we are talking about a cohort that is not under the vaccine regime at this particular point. Are you seeing any particular difference in how their immune system is responding?
Now, what we see is a clinical picture from 7 years and younger, especially those that are being able to start to communicate with you, 3 years and older. They will say to you, my throat is very sore. And yes, they will have what we call a tachycardia, a fast pulse rate. They will have a slight temperature. But again, early in the disease, for those age groups, we treated them, there's not a lot of medication that you can give. So we give them normally a bit of Tamiflu. And whether that works or not, I don't know, but the patient's getting better. So it all depends. And then we will prescribe something like ibuprofen syrup with Panado in to help with the fever. And it seems to work. So that's what we see. We don't really prescribe antibiotics, except the Tamiflu. But the rest we don't really do. We don't prescribe even a lot of vitamins at this stage. The prescriptions that we are giving is much different, or differ quite a lot from what we did with the Delta. Delta is something else. I must say to you, Delta patients are really, really sick. If they come into the surgery, you identify the high risks. 5 to 7 days later, you follow them up, and you can then have a clear picture. Are they going to go without oxygen? Because it's always about the oxygen at that, with Delta, it was really, really, oxygen and beds is a terrible thing to look at and to know where am I going to get a bed, where am I going to get oxygen from. But we don't see this here. And as I've said, this is now the third week. And these people that we have so far see, yes, they do feel bad. Don't underestimate a mild disease. Don't underestimate a severe headache. Don't underestimate body aches and pains, that shoulder pain and that terrible muscle pain. Don't underestimate it. And we have seen with the unvaccinated people, it's become in the last week especially, that when they have a headache or a muscle sort of pain, we call it myalgia, when they have that, they are definitely far worse off than the vaccinated ones. For the vaccinated ones, it's easy sailing going through these with normal medication. Yeah. We also, unfortunately, we don't have a lot of other medication to give to the unvaccinated, but hopefully next time people will start to get vaccinated.
Right. Dr. Coetzee staying on, as well as Dr. Groom. We'll continue and close off the conversation in a moment. Plus, we get in that conversation. Does the Omicron variant pose higher risk in the younger age group, including those in the infants? The doctor's saying not so much. In fact, they are seeing a decrease in those numbers of those being hospitalized. But Dr. Groom, before the break, Dr. Coetzee pointing to the fact that vaccination does certainly play a role. Now, you mentioned that it could be that parents are infecting kids and so on and so forth, and the question being asked, are parents failing to protect their children, and could a vaccinated parent, for example, act differently or maybe transmit differently to the child?
Yeah, so I think it really does point to the role of vaccination, and vaccination not just to protect yourselves. I think obviously in persons who have underlying comorbidities, and particularly older persons, the vaccine protects you. But I think as we move into the younger age groups, it really is a role that you can protect those around you. And I think in some of the early data from Tshwane, from the hospital records there, it showed that the majority of the infants, actually the parents, hadn't been vaccinated. So I think there definitely is a role in terms of the parents vaccinating to protect their children. I think what we usually see is the other way around, where we vaccinate children and try and protect the elderly. We saw that with the pneumococcal conjugate vaccine. So COVID has been a little bit different, but definitely that's why when we talk about vaccination, it's more than just protecting yourself.
Yeah, and therefore does that mean we need to be having that conversation where the younger cohort also needs to now be eligible for the COVID-19 vaccines?
Yeah, so I think we still need to remember that the younger people have mild disease in general. They're very much less likely to have severe disease. I think from the other waves, children that did have severe disease generally were very ill. They were children with cancers or really severe underlying, chronic illnesses. And so we know that the age is a high risk for severe disease. And while we are progressing well with our vaccination in that age group, I think we still need to try and prioritize the elderly. I think, extending into the teenage group has been good. But I think at this stage, we would consider that at some point, and SAPRA would need to obviously also just analyze the safety data in those younger age groups. But I think at this stage, still important to try and protect those at highest risk of severe disease.
Yeah. Dr. Coetzee, are there any clues that we're picking up from other countries, those particularly who are now beginning to vaccinate the younger age group, as to how they are responding?
Good question. Unfortunately, not a lot of data available. Remember, some of them only wake up now to the fact that there's a new variant on the market. So we don't have any data on that. I'm not sure whether Michelle's got some data, but I have to fully agree with Michelle on the fact that, who do we need to protect? We need to protect the elderly. The people especially, we can actually start with the age group 50 pluses at this stage to try to start to protect them as well. And then we need to protect the healthcare workers. It is a shame that a third of our healthcare workers has not been vaccinated yet. I would suspect that if you are a frontline worker, You are supposed to understand vaccines. You are supposed to understand the value of vaccines. You're still working with people in a hospital setup or in any other health facility environment, and you still refuse to get vaccinated. That is, it's mind-boggling. So we need them to be vaccinated. We need to protect our people above the age of 50. And again, I'm going to say it again and again, the smaller children, their immune systems are so primed with all the infections that they have and all the vaccines that they have received, that they're not our biggest problem at this stage, except for spreading the virus, but there's nothing we can do. We do not vaccinate in South Africa under the age of 12. And there's no need now to start to rush and try to get them vaccinated. Let's first get the people who need to be vaccinated, and then we come back and we speak about the other groups.
Dr. Michelle, when are we likely to know more? I know the NICD saying they will be releasing a report on these pediatric admissions.
Yeah, so I think we are looking at the data. We'll, release a report. And I think also just to bear in mind, we've seen this very rapid increase in cases over the last week or so. And I think we need to, we really hope that it stays mild. But I think we're seeing the infections moving into the older age groups as well. And I think it's, we need to really just watch in terms of severity, particularly for the unvaccinated, because we know that the severe outcomes, hospitalization, deaths, usually follows 2 to 3 weeks later. So I think the next couple of weeks are really critical to just see, where we're headed with this fourth wave. We're obviously in a much better position than we were at the beginning of the third wave, with, I think just over a third of our population fully vaccinated. And I think, our elderly really, I think there's been a lot of drives to get our elderly vaccinated. So I think, we would expect that the vaccines would still protect against severe disease.
Appreciate you both for coming through, and thank you very much for your intervention and information shared, Dr. Michelle Groom, as well as Dr. Angelique Coetzee there with us tonight. So there, Dr. saying no need to be alarmed at this particular point. No signs or evidence that there is a higher risk for the younger cohort.